In the year 2015, I started having symptoms of malaria, weakness of the body, loss of appetite, loss of weight. In the night, I would be sweating anyhow. I didn't know what was really wrong with me. But then I took malaria treatment. After the malaria treatment, the night sweat refused to go. I was coughing. And before you know, I started observing blood in the sputum. So I went to Nyanya Dot Clinic, did the test, and the test came out positive to tuberculosis. Further examinations on that test showed that it was MDR-TB, that's multi-drug resistant tuberculosis.
Tuberculosis, often referred to as TB, remains a leading global health threat as the deadliest infectious disease. According to the World Health Organization, in 2022 alone, an estimated 1.3 million people lost their lives to tuberculosis. Initially, multi-drug resistant TB was attributed to patients who failed to take their medication correctly or complete their prescribed treatment regimen. However, today, multi-drug resistant TB poses an even graver public health concern.
It is a form of tuberculosis that is resistant to one or more of the first-line drugs. In some instances, somebody can get infected with a resistant germ directly. So we have, WHO says about 4.3% of new incidents of tuberculosis in Nigeria, they are multi-drug resistant. That means that the person has never had TB before. The first TB is having is multi-drug resistant. But we also have instances where 15 to 25% of previously diagnosed TB cases can turn multi-drug resistance if they don't complete their medication as prescribed. The minimum treatment, as of today, the minimum treatment for tuberculosis is 6 months.
I spent 4 months intensive in the hospital. So for those 4 months, I was away from my family. The total duration of the disease treatment was 20 months. When I returned from the hospital, the FCT disease program gave me another letter to confirm to my employer that I was okay for them to take me back. I met with the head of HR, who told me that, in clear terms, that the bank cannot take you back because if any staff comes down with this particular disease, it will be as if he contacted it from you. That day I was so downcasted. I was so angry, knowing that I was going home to meet my wife and baby that I could no longer provide for.
The global health community is on high alert due to the rise of multi-drug resistant TB, which complicates treatment efforts and threatens to undermine decades of progress.
Drug-resistant TB or multi-drug resistant TB is a typical example of antimicrobial resistance. The effect of antimicrobial resistance in public health is that we now need more resources to take care of ailments, to take care of what would otherwise be treated with simple medication. You may now need stronger, more expensive medication to treat them. Maybe medication that you would use a treatment for like a day or two. You now need longer days, to handle them, and then because of resistance as well, there are instances where those people that were not vulnerable to the disease, they become more vulnerable to it.
Dr. Polycarp Salam, an epidemiologist with the African Field Epidemiology Network, AFINET, explains that antimicrobial resistance is a complex and urgent public health crisis that requires a multifaceted approach to tackle.
The policies, I think the policies are there. It's just the enactment of the policies. The pattern medicine vendors are supposed to be triple checked. The drug hawkers are supposed to be triple checked. Counterfeit drugs are supposed to be triple checked by, of course, NAFDAC. Then, of course, to us, there's no reason why you should self-medicate.
The rising threat of antimicrobial resistance, including multi-drug resistant tuberculosis, calls for coordinated global action. By being more mindful of how we consume antibiotics and adhering to medication guidance, we can collectively help mitigate the impact of antimicrobial resistance and protect future generations. Lois Abasambo.